Hello and welcome to Season 2, Episode 57 of the Physician Assistant Exam Review Podcast. This week, we're going to be continuing our discussion of pulmonary infections. At this point, I have lost count of how many times I have recorded the opening to this particular episode. I don't know what's going on this morning, but I'm struggling to get this recorded and out for you. Well, hopefully this one will work out a little bit better. Like I said, this week we're going to be covering pulmonary infections. We did pneumonia last week, and we're going to move around a little bit and cover a couple different things today. We will not finish pulmonary infections today. We will finish it in the next episode, but we'll get a good chunk of it, a pretty big jump on it today. So that's great news. You can always find all of the notes over on the website, www.physicianassistantexamreview.com. And the big deal is, for this week in particular, this is a time-sensitive episode. This is going to be released on November 5th, 2019. And if you haven't yet, I always encourage it, obviously, to go over and sign up for the email list, because that's where I do daily emails, and I send out all kinds of information as far as test taking and study habits and all kinds of stuff that I think is incredibly valuable. To me, I think it's easily as, if not more valuable than the medical content and that information. So anyway, I always recommend that you get over there, but this week in particular, because next week I'm going to be doing, this is something that will only be announced through the email list, and this will be the only time I mention it in the podcast, because next week it'll be too late. And I'm going to be running a huge giveaway of study materials. It's going to be set up so that I haven't put, blah, 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 blah. So I'm not going to restart this because I've restarted it 30 times already. But that package is going to include all kinds of amazing study stuff for you. I have a couple other PA bloggers and review people who have agreed to contribute to that package. So it should be really great. But the only way you're going to hear about it is through the email list. So absolutely get over there. If you haven't gotten on that yet, head over to the website. It's super easy. You can find it right in front of you when you get there, www.physicianassistantexamreview.com. And again, that's going to happen next week. So make sure you run on over there and get signed up for that. And you also get, like I said, get just tons of my best material as far as study habits, test taking, all of that great stuff. So anyway, go on over there and check that out. But I would be very sad if you missed access to that giveaway. Anyhow, let's go ahead and get started for today with our priming questions. One more thing real quick before I do that. I have gotten a complaint or two about the sound levels in the podcast that people are having a little bit of trouble hearing. And I am having trouble detecting a reason for that, and I'm not really seeing that on my end. I've done a little bit of diagnostic work to try and figure it out. I am doing things a little bit differently than I did in the past. I have a new soundboard and a couple other things. But if you are having that issue and you're having trouble hearing the podcast, please let me know, because the more information I can get, the better chance I have of fixing that problem. Because like I said, I'm just having trouble finding it on my end. Anyway, let's go ahead with our priming questions. In what disease might you see a steeple sign? What disease state might you see a steeple sign? I screwed this up and gave you the answers in the last episode. We're not going to do that today. Acute bronchitis typically comes after what illness? Acute bronchitis typically comes after what illness? How do you separate bronchitis from bronchiolitis on a test question? How do you separate bronchitis from bronchiolitis on a test question? And what is the most important thing to do if you expect epiglottitis? What is the most important thing to do if you expect epiglottitis? All right, so we'll go through and answer those as we go. Please keep those in mind as we move forward. That's how you anchor some of this information in your head as you think about those as we move along. And that should then help you to retain it long term. We talk a lot about active studying versus passive studying here. And I'm going to get to that in a little bit in our study tip at the end and point out a few places where this stuff should really stick for you, in places where normally if you just read through it, it doesn't stick at all. You barely remember it. So let's see. We're going to start with acute bronchitis. Acute bronchitis is an infection of the large bronchi. So just like pneumonia, we kind of talk about areas or locations of diseases here. So it gets a little confusing. We don't just talk about the bugs that cause it, but we talk about where it's caused. Sometimes it has to do with the bug that causes it, but a lot of times it has to do with location. So this is an infection of the large bronchi, most often caused by a virus, right? So 5 to 10% are bacterial and the rest are viral. So keep in mind, and they're pushing this obviously more and more with acute bronchitis, that antibiotics play a smaller role than we used to think. People will come in asking for antibiotics, but the reality is they're not going to help in most cases. RSV, rhinovirus, and influenza are major causes here. And usually it follows an upper respiratory tract infection. So usually bronchitis comes a couple of days after or along with an upper respiratory tract infection. Clinical presentation is shortness of breath and a cough. That's really our key here. That can last for more than 3 weeks and takes a long time to resolve. It's that long-standing cough. You can get some wheezing and a fever with this as well. Labs and studies and physical exam findings. You can get a prolonged expiration. You can get wheezing or rhonchi. X-ray may show hyperinflation of the lungs. And you might get an X-ray just to rule out pneumonia in these people. And you also might do a sputum gram stain for the same reasons. Treatment is going to be a little bit of prevention with the H flu vaccine. Supportive care, fluids, rest, use of a humidifier, and then medications. So antibiotics usually frowned upon here. Things like acetaminophen. And then if necessary, you can do anti-cough medications and albuterol. I can tell you, probably was before the kids were born. Now I'm thinking about it. So it's probably 10 years ago. Wow. Where I had just an awful case of bronchitis. It just lasted a long time. I'm as dumb as the rest of the medical profession. I don't go see a doctor until I'm dying. And I finally went in, and the thing that was the greatest thing that they did for me was give me something for my cough so I could sleep through the night. It was just absolutely amazing. And it was amazing also what a little inhaled steroid did to settle things down for me. At that point, I was in a very bad situation. I hadn't slept in weeks. But that was just absolutely unbelievable how much that affected my bronchitis and how happy I was literally the next day. Next, we have acute bronchiolitis. So this is an infection of the smaller airways known as the bronchioles. Now, here's our separator, most commonly in children under 2 years old. So one of the things I want to point out is as we go through this, the clinical presentation here is coughing, wheezing, shortness of breath. Well, coughing, wheezing, shortness of breath, maybe a fever. That sounds just like bronchitis. It's going to sound like a lot of our lung infections, right? So you have to figure out ways to separate these out. And the way here would be through the idea that it's children under 2 years old. You're not going to remember each of these things, right? It's just not going to happen as independent entities. It's just too difficult. There's too many. But if you can compare them to each other, if you can find reasons to separate them, that's where you're going to have success. Typically, this is a viral infection, most commonly caused by RSV, respiratory syncytial virus. That's going to be our number one culprit here. And it can be caused by a slew of different viruses. Adenovirus, influenza, parainfluenza, and rhinovirus are certainly on the list, but it's that RSV that's the main culprit. When I did my peds rotation, I was on the floors and everybody had this. I mean, there were just rows and rows and hallways filled with kids with RSV. I mean, it was very sad to see all these little kids in their cribs, just little snotty coffee messes with this RSV. Clinical presentation is coughing, wheezing, dyspnea, and decreased feeding is on that list. Again, we're talking about kids under 2 here. Lab studies and physical exam findings, you can get crackles, wheezing, elevated respiratory rate. The chest wall retractions and accessory muscle breathing is a good indicator for a little bit of respiratory distress for kids. Nasal flaring goes on that list. And again, a chest x-ray maybe to rule out pneumonia. Treatment is going to be supportive care, so use of a humidifier, some fluids. You can use nebulized albuterol or epinephrine, depending on the severity of the situation. It tends to be self-limiting, though. Again, it's a virus, so we're not going to use antibiotics typically here. Next, we have acute epiglottitis. And this one should jump off the page at you as something that is a great thing for them to ask you test questions on. Hopefully you don't see this, but it certainly is something that is easy to write test questions for. This is an inflammation of the flap of tissue which covers the trachea and the surrounding tissue. So obviously, if that tissue gets inflamed, this is a medical emergency and can lead to obstruction of the trachea, which can also lead to death, right? So if the epiglottis isn't functioning, then the patient isn't breathing. So this is an emergency situation as soon as you start to recognize this. This is typically a bacterial infection, but it can be viral. Again, we're talking about a location here. So it's the epiglottis and the surrounding tissue. Historically, this was caused by Haemophilus influenza B, but since we've been vaccinating for that, those have decreased to very, very low rates. You can also be caused by strep, staph, and a whole bunch of other bacteria. Clinical presentation. Difficulty swallowing and drooling are major ones here. These should be bright red flags for you. If you have a young child, even an adult, I think you would typically see this with kids, but you could see it in adults. Difficulty swallowing and drooling. It should just, if you see that in a test question, you should just absolutely be thinking epiglottitis. Severe sore throat, hoarseness, and stridor are other good ones. All of those, right? Those don't sound anything like what we talked about for bronchitis or bronchiolitis or pneumonia or anything like that. Those are presenting systems that are all presenting signs that are all on their own. You can get, and then you have the classic tripod position for these patients as well. Lab studies and physical exam findings, they have shallow respirations. An X-ray of the lateral neck may show the thumbprint sign, which is an enlarged epiglottis. The thumbprint sign. Now, the way you're going to diagnose this is going to be with actually looking, right? You're going to have to look in the throat. The problem is that you can cause spasming and the airway to close. So this has to be done in an operating room with somebody who can intubate, right? This isn't something that you just do in your office. You have to be able to get control of the airway or the patient can go into respiratory distress very, very quickly with that obstruction. Our first line of treatment is going to be with prevention, right? With that H flu vaccination. But then number one key here is if you suspect epiglottitis is be absolutely ready to use to secure that airway. Someone's going to have to intubate in order to protect this kid. Keep the child calm and relaxed. They may need oxygen. Antibiotics here is a second or third generation cephalosporin. Ceftriaxone is a good example. And then in an extreme case, a tracheostomy if necessary. Next, we have croup or laryngotracheobronchitis. And here's another good one you can separate out. This most commonly affects is 6 months to 3 years. The most common age this affects is 6 months to 3 years. And it usually occurs in the fall and the winter. So bronchitis is any age, probably more like adults, but can be anybody. Bronchiolitis is under 2. Croup has a whole bunch, epiglottitis has a whole bunch of different signs that aren't really like the rest of these. And croup is 6 months to 3 years. Most commonly, a virus the number one is the parainfluenza. Also, respiratory syncytial virus and rhinovirus and a bunch of other viruses can all cause this. Clinical presentation is a low-grade fever, congestion, and then that barking or seal-like cough. That's your key here. The barking or seal-like cough. That's how you will separate out croup on a test question. You can also get stridor here as well. An X-ray of the neck and chest may show a steeple sign, which is a subglottic narrowing, which may also be normal finding in up to 50% of kids, so kind of useful, kind of not useful. It's the subglottic narrowing, though, is the steeple sign, and that goes along with croup. So although that may not be super useful in your clinical practice, certainly a test question that's easy to write. Treatment is supportive care, use of a humidifier. You can definitely use oral steroids here to calm everything down. And then nebulized epinephrine is always will help as well to increase airflow and oxygenation. All right, so that's as far as we're going to get with our discussion of infectious diseases today. As far as the pulmonary system is concerned, the one thing I did want to point out to you, so our study tip for today, is what I've been doing as I've been going through these questions. It's thinking when you're studying. It's not just reading these over. It's comparing them to each other and deciding how you would know or recognize the difference between certain diseases that are pretty similar. You know, if you have to discuss Cushing's and Addison's, you shouldn't discuss them in a vacuum. You shouldn't learn them in a vacuum. You should learn them as compared to each other, because that's how the test questions are going to be. Strider and Croup are going to be two answer choices on a test question. You're going to have to be able to decide between them. So as much as you want to memorize everything about all of these diseases, to me, those keywords have always been one of the most important things, not because it's just easy to memorize them, which it is, but because they help you to separate one disease from another. The key terms that go with a disease have to go in the test questions. So that's where you need to start. You need to be able to pick those out, and you need to be able to remember those. So to me, when I say key terms, I'm also meaning things like the fact that croup affects kids 6 months old to 3 years old. Well, that's kind of a key term. That's something I should recognize when I see a test question. All right, let's go ahead and move on and answer our pre-test questions, or our priming questions, and see how we do with those. The steeple sign may be seen in what disease? Steeple sign may be seen in what disease? Croup, right? It was croup, although 50% of kids may see it anyway. Acute bronchitis typically comes after what illness? This was all the way at the beginning. Acute bronchitis comes after what illness? Usually it goes right along with an upper respiratory tract infection. How do you separate bronchitis from bronchiolitis on a test question? I covered this a lot today. How do you separate bronchitis from bronchiolitis on a test question? If it's a kid under 2, it's probably bronchiolitis. The most important thing to do if you expect epiglottitis, this should be an easy one. If you've got a kid who's drooling, severe pain, can't swallow, protect the airway, protect the airway, protect the airway. That's the most important thing. The most important thing, absolutely 100%. Super easy to write a test question on, so make sure that you've got that one down. All right, so that'll take us out for today. We will continue with pulmonary infections in episode 58 and wrap that up. We're moving right through pulmonology, which is awesome. So that's really, really good. And like I was saying at the beginning of the show, please get over to the website, www.physicianassistantexaminereview.com, and get yourself signed up for the email list so you do not miss out on the amazing giveaway I have for you next week. It's going to be a lot of fun, and I don't want you to miss that. Good luck to anybody taking their exams this week, and I look forward to hearing from you. Take care.